Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Ballens.
Well, hi there, Dr. Darrow.
Hello, Nita. How are you today?
I'm great. How are you?
I'm living it up. Why not?
Yay. That's what we want our listeners to do, too, right?
Absolutely. Absolutely. We're going to teach them how to do it today, too.
That's cool. And the first thing you can do is you can give us a call because we have a fantastic free book for you today. When you phone 866-870-5752, you get Dr. Darrow's latest book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, and the foreword is written by Suzanne Summers, who wrote a book called A New Way to Age, and she put you in that book.
She's very nice to me. Yes, she's written a couple books that have chapters about the work on stem cells and platelets, what we call regenerative medicine. So thank you, Suzanne Summers. She's an amazing person. She teaches quite a bit about the greatness of using natural medicine, which is something that I've always been attracted to. And even before I was a doctor, I was always into natural medicine. After my residency at UCLA, I did a 4-year residency in physical medicine rehabilitation after medical school. I went on to do another fellowship, which is advanced training in natural medicine, how to heal the body without drugs and surgery, which I think we need to do more and more of today. It's been around forever, and unfortunately it's called alternative medicine, but it certainly is not alternative. What is alternative is high-tech medicine, which, in my humble opinion, causes a lot of problems for people. It's needed quite a bit, no question about it, but it's overused, especially in giving people a lot of drugs and cutting when they don't need to be cut. So I hope you will call me up now to talk about all of this and talk about your pain issues in the musculoskeletal realm. That means your tendons and your ligaments and your joints and your neck pain and back pain and shoulder pain and hip pain. And we get a lot of weird stuff. Some people have, external abdominal pain where the muscles are torqued. Another thing that happens quite a bit, we get something called sports hernias. So people think their doctor tells them they have a hernia, like an inguinal hernia, but the doctor never touched them to find out what's really going on. So one of the things I pride myself on is actually touching the body, doing an examination, and finding where the pain generator is. The pain generator is the actual spot that is causing the pain. So this can be anywhere from, the bottom of the feet all the way to the top of the head and everything in between. We take care of arthritis in the hips and knees and toes and ankles. And I saw a really nasty case yesterday. I felt so bad. A woman injured her ankle very, very badly, fractured it. And she had something done that was very cool in a way. She had no cartilage left, so she went to a doctor in New York who was a surgeon, and they put distraction rods on the bones and pushed the joint open and then put stem cells in that way, and she got a lot better from that. It's starting to wear out again, so we're going to go back in there and heal it up. But we take care of a lot of things that, most doctors think cannot be helped in the orthopedic realm. And I have most of my patients come in who say they've already had an orthopedic consult, and they've been told by more than one orthopedic surgeon or neurosurgeon that they must have surgery. Some say they must have surgery or they'll be paralyzed, and there are cases of that, but it's not really all that common. And most of these people don't need to get surgery, never have the surgery, and are doing great. Nita, you and I hear it on the radio all the time where people call in and talk about their stories about how they were told they had to have a surgery years ago, never did it, and they're fine without anything.
Right.
You know, most people heal without doctors, thank God. And another thing we see a lot of is people that have what we call sciatica, you know, pain down the legs, and they've been told they need surgery to remove a herniated disc or something that's pinching a nerve or extruded disc. And they never did anything, and they're all better. 94% of those, according to the studies, just heal without doctors ever touching them. But if you do go to a doctor, be careful. Make sure you get several opinions if someone says you have to get surgery. If it's an emergency, I understand. But the question is, what is an emergency? Just because you have pain down your leg or down your arm, that typically is not an emergency. That's something that normally is going to go away by itself, but if it doesn't, if it's chronic, if it lasts more than several months, then there are other things that can be done. Sometimes it's just a referral pattern, a trigger point from the neck down the arms or from the low back down the legs. And how do you find it? You've got to touch the area, push on it, or put a needle in it and see if that gets rid of it. Because I've had that happen too, where people have had tremendous headaches, and I'll find a spot on the back of the neck and inject it, or on the back and inject it, and the headache will go away instantly. So I'm not saying that happens all the time, but I've had cases of it. So we don't want to operate on something that doesn't need a surgery. That's really I'll say the white horse that I ride on, that I've been doing for the last almost 25 years or so, which is saving people from getting surgeries. And I learned the hard way. You know, I tell the story on every show. I had a shoulder surgery when I was doing orthopedic surgery in fourth year of medical school. I loved doing surgery. It was a lot of fun. I felt like a real stud, you know, ortho. We used to run around the campus, you know, in medical school. There were 3 of us that were going to do orthopedic surgery. And after my surgery, and it failed terribly, I got out of orthopedic surgery and went into physical medicine rehabilitation, which is a non-surgical field that does orthopedics. And I learned about the wonders really of regenerative medicine. And I actually, the first thing that healed on me was my wrist, and that was about 50% better overnight. And then my shoulder was 100% overnight healed. And then I started doing it on my patients. And it was kind of funny because in the beginning I was so uncertain about this field because no one was doing it. And I was kind of scoffed at UCLA for doing it. Then I started teaching it at UCLA. I taught it there for 20 years. And most of my students are now older doctors that are doing it all over the country. I do have people that come from all over the country. I have a woman coming from Ohio who's a doctor very soon. I just had a doctor spend 4 days with me from Hawaii learning how to do it. And it's something that, you know, in medicine they say, see one, do one, and teach one. It's an apprentice system. And obviously it's not that simple. But I've been doing this a long time, and I've trained, oh my gosh, I don't know how many hundreds of doctors on how to do this. And it's something that I love, I adore. And I would love to get your calls right now. If you don't mind calling me at the studio, I'm going to give you a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It took me 5 years to put all the studies together in this book because when I lecture on this, a lot of doctors who are orthopedic surgeons or neurosurgeons stand up at the end of my lecture and they're grumbling, going, where's the research? Come on, where's the research? And I go, where's the research on your surgeries? Because the research on your surgery show it doesn't work very well. But there is plenty of research in this book. There's 256 studies that talk about surgeries and how they fail, and talk about how regenerative medicine using platelets and stem cells from your own body can heal you up, and very quickly and very simply. You just walk in and get injections and walk out. It's not a big deal. You don't even need anybody to drive you. You can just do it yourself. So the phone number to talk to me right now, we have a few calls coming in. Grab your spot now because People often wait till the end of the show and then we're jammed up and we can't get to you. But the studio office right now, or to call me right now, I'm sorry, at the studio, is 866-870-5752. Richard will get to you in a second. That's 866-870-5752. And if you're too shy, I hope you're not, you can use a fake name or talk and pretend it's your father or your sister or your friend or whatever to ask questions about the musculoskeletal system and how to heal it. You can also call my office. We always have people by the phones, and that number at my office in Los Angeles is 800-300-9300. LAstemcells.com is the website, www.lastemcells.com. And if you don't want to call, you can go directly to the website and watch videos of me doing these procedures all over the body. And also every page on my website has a spot where you can email me. I answer emails all day and all night long. For those of you who are listening who know me, you know I am in constant contact with my patients. And I give out my cell number to every patient who walks in the door. And I tell them this is a lifelong relationship, even if you go to another doctor. I'll still be there for you to help you and assist you in your path to health. So Richard, let's talk to Richard. He's got low back pain. Richard, Dr. Marc Darrow, how are you today?
Can you hear me okay?
Oh, yeah, that's beautiful. Go for it.
Okay, while we're waiting for some callers, I thought I'd, call the expert and just pick your brain with a few questions if I could.
Yes, go for it, Richard.
Okay, well, I listen every week, by the way.
Oh, thank you.
I'm 68. I'm retired. I sit a lot. The beginning of the week, I went to bend over to pick up the bathroom scale.
Yep.
And I felt a knife go into, like the very top of the hip,
yep.
at the side and the back.
Yep.
And I could barely straighten up. And before it had a chance to get worse, I got in the shower and I just got the stream as hot as I could on both sides. I believe it's the sciatic nerve. I've had this before when I was working as a mailman.
Okay.
I haven't had it since. And I'm fine when I sit. It's if I get up or if I lean side to side, I still have discomfort. And I was wondering, is it good to do hot, or should I do hot and cold alternatively, or should I use an ice pack? What's the best way of I don't know what I did. I think I pulled a muscle. I'm not sure.
Well, number one, you're talking about an area right above the buttocks, right, in the pelvis. And
yes.
There are ligaments that attach the vertebrae to the pelvis there. That's number one. Number two, there is a muscle there called the quadratus lumborum. You can write these terms down, and then you can go look on Google and put the term in, and then up at the left-hand corner, there's a spot that says images, and you can actually look right now at what I'm talking about. There's also something called the thoracodorsofascia that attaches there, and the iliolumbar ligaments. So you can look at all those things, and they all attach to the pelvis. And it's very common for them to be sprained. Okay?
Mm-hmm.
Sprain just means the tissue is stretched a little bit, like a sprained ankle.
Right.
So most injuries that people have are really nothing more than a sprain. When I say most, that happens to people, all the time. There's nothing to really be concerned about. If you have a sprained ankle, you don't go to an orthopedic surgeon to have a surgery, do you? No, it usually heals up. I've sprained my ankle so many times I can't remember because I'm a runner and I run in the mountains, and I do stuff that a lot of people wouldn't do because I'm crazy. I like to sprint. I like to pretend I'm still 16 years old. And spiritually I am. There's no question about it.
I second that.
Yeah. About me or about you?
About you.
Yeah, I'm very sophomoric. I love to laugh.
As long as Dakota doesn't get in your way, right?
Oh my God, you should see Dakota today. He's so old. He just kind of lumbered, and he got very, very big. He's 85 pounds.
Oh
and
my gosh.
he's moving real slow. He had an ACL rupture in his left hind leg. So
no.
my wife won't let me take him running anymore because she's afraid the other leg will burst, with the ACL. But he's a good guy. He's always been a good guy. He's 12 years old,
Wow.
12 and a half years old. So times 7, what is that, 70? He's 85 years old, and he's showing his age. He actually has hair growing on the bottom of his feet now. We have to cut the hair on the bottom of his feet. You know how when dogs they get real old, they get hair coming out of their face and funny parts of their body. But he's a great guy. And anyway, yeah, you know the story. He was in the dog park with me when he was a lot younger.
Yeah.
And my huskies would just sprint all over the place. And I would hook them together up here in the mountains where I live. I'd put a leash on the two collars and hook them together, and they would pull me. So what do you call that? 2 dog power or something instead of horsepower? I don't know. But we really went fast up and down the mountains. And, I've sprained my ankles, I've sprained my knees, and my low back like yours, I've sprained. I've sprained my arms with them tugging on me. And those things usually go away. Sometimes they don't, and when they don't or they didn't, then I would just inject them. I would go right to my office and I would inject them myself with my own cells. So it's an easy process to do, especially low back. I think, what I probably end up doing the most are knees. People, they say the knees go first, and a lot of people injure their knees more so probably than anything else. I think low backs are probably second. But I do every part of the body. There's no part of the body I don't do because people get these sprains or muscle tears or meniscal tears in the knees and rotator cuff tears in the shoulders. And tendinosis is very common. That means that the tendon is worn down a little bit. Tendinitis is a term that means that there's a new tendon injury. It's acute. Acute means new, first 3 months. And then as it becomes more chronic, we call it tendinosis or wearing down. But your low back, I'm not concerned about at all, Richard, from what you're telling me.
So you said muscle could be stretched out?
Yeah. Mm-hmm.
Okay, so it wouldn't do any good to do exercises to stretch it out more.
No. You can do anything you want. You can try anything because you're not in any kind of dire straits. There's no emergency.
No.
You play with it. You play with your injuries and see what works. I'm sitting here right now at my desk with something. I'm going to show it to the video camera. This is a Graston tool, and you can look up Graston on Amazon.com, Graston tools. And people use things like forks or knives as a Graston tool. We actually rub out the tissue. And a lot of things that people get are just the fascia, which is the coating over the muscles that gets scarred up a little bit and need to be rubbed out. A lot of physical therapists use these kind of techniques. Ice massage is one of those. So there's a million things that you can try in your low back. I'd love to see you. If you want to just pop in sometime.
Did you say ice?
Ice, sometimes people just take ice and put it into a wax cup and then freeze it, or put water in there, freeze it, and they take that out and they use that to kind of rub out an area, stretch it out.
Okay.
And it's cold at the same time. As to whether heat or cold is better, there's no such thing. On something like yours, which I believe is a sprain.
No such thing. Okay.
Well, I'm sorry.
Maybe I should try.
When I say there's no such thing, no one knows the best thing is what I'm saying. You try out what works for you. So heat is great. Ice is great. Heat will relax the tissue. Ice will contract it. Heat will open up the blood vessels. Ice will slow down the blood. When people have a new injury, they typically are going to use ice because ice gets rid of initial pain. It's amazing like that. But at the same time, a lot of people like me don't like to use ice because you want to get the blood flow there.
Yeah.
And you want to have cells called fibroblasts get to the area So the RICE protocol, rest, ice, and compression, elevation, are things that guys like me don't like to use, but most doctors do like to use that because it makes the patient feel better. We like the swelling in the area. When I inject you, if you came in and we injected your low back with your platelets or stem cells, that causes inflammation. We want the inflammation there to bring fibroblasts to the area to heal the area.
Yeah.
Well, Richard, you're a great guy. I love you. Thank you so much for calling in. We're going to send you a free copy of my book, Stem Cell and Platelet Therapy. Regenerate, don't operate. That means regrow the tissue, don't cut it out. And we've got a full board of callers here, so we're going to get to Ronnie next. Ronnie, you hang in there 1 second, man. I'm going to give out the phone number. Anyone who wants to call me now and talk to me live, I would love you for doing it. And you get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. The phone number here right now to talk to me and torture Nita a little bit if we have to tell her jokes. Nita, we're going to have to tell you.
I think we're too busy for jokes right now.
No time for jokes, but
No
if
time.
you guys don't call in, we're going to have to torture Nita. The phone number to the studio is 866-870-5752, 866-870-5752. And if you want to call the office at any time, the number there is 800-300-9300. If you want to watch videos of me doing these procedures of stem cells and platelets, just look on your internet and put in my website, which is www.lastemcells.com, www.lastemcells.com. You can also email me from every single page on my website. It's a huge website. There's a lot of information there. So, Ronnie, let's go to you. This Dr. Marc Darrow. Your leg is bothering you, and you have sciatica. How long has that been going on?
Yeah, hi, Dr. Darrow. Can you hear me?
Beautiful. Yeah, I can hear you perfectly.
Okay, my name's Lonnie. I think the screener got it wrong.
Ronnie?
No, Lonnie.
Sorry, Lonnie, Lonnie?
Yes.
Okay, we got you, Lonnie. Go for it. How long has
I talked to you over 10 years ago regarding knees on a bicycle, but I had a near-fatal bicycle accident and recovered fully, but now
oh my God.
I'm having sciatica problems. So do you treat that? And that?
Well, you have to explain a little bit more, so let me ask you some questions. Do you have any back pain?
Sure.
Sure, you have a lot of back?
Yes.
Okay. Which is worse, your back pain or your leg pain?
I think the hip pain, actually.
Okay. So when people say hip and they're talking about their back, it's usually above their buttocks they're talking about. Is that correct in your case?
Yes, but it does radiate down my leg.
Okay. So most actual hip pain generated from the hip joint, people feel in their groin, in the front. So the stuff in the back, people call it their hip, but it's not their hip really. I understand you when you say your hip. But that generally can be the gluteus medius muscle, and you can look that up on the internet. Okay, just put in gluteus medius, Google that, and then on the upper left-hand corner, click on images, and you'll see what I'm talking about. And if that's what it is, and I won't know unless I touch your body to tell you what's going on. I don't diagnose based on MRIs or X-rays or CT scans. They're useless in these kind of cases. I get them, and I want them, because often they'll show things that I didn't know were there, that we didn't even think about. And I have diagnosed a few cancers based on getting MRIs or other images or other things. One time I found blebs in a lung, things that we weren't looking for. When I was looking for back pain, back issues, I saw the lung, and a guy had a bleb there, which could have killed him because he was a scuba diver, and had he gone down in the water, he probably would have died. So we saved him with an image, but it wasn't related to what I was looking for, which was his back pain at the time. So I always get images. In this day and age of lawyers, we have to be super careful as doctors, and we have to go overboard. When I was in training, we were taught not to use images unless we had to, because we were supposed to not spend the money for images. Hang with us. We're going to go to break. This is Dr. Marc Darrow, Living Pain-Free. Give me a call. We're at the studio at 866-870-5752. And if you can't catch me now, go to my website, www.lastemcells.com. We're going to go back to Lonnie in a couple of minutes. Let's go to the break. Thank you, Nita Valens.
Well, thank you, and we'll be right back after this.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.